Hi all, welcome to our Allied Lecdem channel. In this video, we are gonna see about metacarpal and phalanges bone. So let's get into the video. First, we will see about metacarpal bones. Metacarpal bones are five miniature long bones which are numbered from lateral to the medial side. That is, the hand contains five metacarpal bone that articulates proximally with carpal and distally with proximal phalanges. They are numbered moving lateral to medial and start with the thumb, which is metacarpal 1, and ends with metacarpal 5, that is little finger. As we saw, every bone has parts. In metacarpal, it has head, which is placed distally, a shaft, and a base at the proximal head. The head is round and it articulates a face which extends more anterior-posteriorly than laterally. The head of the metacarpal bones form the knuckles in our hand. The shaft is concave on the palmar surface. Its dorsal surface bears a flat triangular area in its distal part, whereas the base is irregularly expanded. Next are the characteristics of the metacarpal bone. The first and foremost is it is the shortest and stoutest of all metacarpal bone, and the dorsal surface of the shaft is uniformly convex. Next is second. The second, the base is grooved from before backward. The medial edge of the groove is larger. The third one, the base has a styloid process projecting up from the dorsolateral corner. The fourth one, where the base has two small oval facet on its lateral side for the third metacarpal. On its medial side, it has a single elongated facet for the fifth metacarpal. The fifth metacarpal bone, the base has an elongated articular strip on its lateral side for the fourth metacarpal. The medial side of the base is a non-articular and bears a tubercle. Next, we see the articulation of the metacarpal bone, that is the movement which is being provided by it. Besides the metacarpophalangeal joints, the metacarpal bone articulates by carpometacarpal joint as follows. The first one with the trapezium, whereas the second one with trapezium, trapezoid, capitate, and third metacarpal. And whereas the third bone with the capitate and second and fourth metacarpal, whereas fourth with capitate, hamate, and third and fifth metacarpal, whereas the fifth bone with the hamate and the fourth metacarpal. Next are the insertions of muscle seen in the metacarpal bone. The first and foremost is extensor carpi radialis longus or brevis. Both insert on the base of the metacarpal 2. Next is extensor carpi ulnaris, which insert on the base of metacarpal 4 and which assist in the flexion of the wrist. Whereas next is the abductor pollicis longus, which inserts on trapezium and base of metacarpal 1, and the functions are extends the thumb at carpometacarpal joint and abducts the thumb in the frontal plane. The next are opponent's pollicis and opponent digiti minimi, which inserts on metacarpal 1 and inserts on medial surface of the metacarpal 5 respectively, and the function is flexes the metacarpal 1 to oppose the thumb of the fingertip, whereas the digiti minimi helps when the little finger is moved into the opposition with the tip of the thumb and deepens the palm of the hand. So, in this diagram, we could see some important muscles which has been inserted like extensor carpi radialis, extensor carpi ulnaris, abductor pollicis longus, opensis pollicis, and digiti minimi. The next are the clinical anatomy relevant to the metacarpal bone. So, as we take off bone, the first and foremost is fracture. The neck of the metacarpal is common location for the boxer's fracture. However, all part of the metacarpal bone, including head, body, and base, are susceptible to the fracture. So the treatment for this undergoes non-operative technique with or without immobilization or an RF technique, that is open reduction and internal fixation. Next is the congenital disorder, in where fourth and fifth metacarpal bones are commonly blunted or shortened in pseudo-hypoparathyroidism or pseudo-hypoparathyroidism. A blunted fourth metacarpal with normal fifth metacarpal can signify the Turner syndrome, which is a genetical condition. So, these are the things about the metacarpal bone. As we know, it has head, shaft and base. We also see the articulation. Apart from metacarpophalangeal joint, it also articulates with carpometacarpal joints and insertions of important muscles like extensor carpi radialis, abductor pollicis and so on. So next, we'll move to the phalanges bone. We know that there are 14 phalanges in each hand, 3 for each finger and 2 for thumb. So each phalanx has base, shaft and head as we saw in the metacarpal bone. Base. In the proximal phalanx, the base is marked by a concave oval facet for articulation with the head of the metacarpal bone, whereas the shaft tapers towards the head. The dorsal surface is convex from side to side. The palmar surface is flattened from side to side but is gently concave in its long axis. Whereas the head, the proximal and middle phalanges, the head has fully shaped articular surface. So in this, the articulations is being brought by metacarpophalangeal joint, which is between metacarpal and proximal phalanges. Next is proximal interphalangeal joint, which is between the proximal and middle phalanges. Next, the distal interphalangeal joint by middle and distal phalanges. The thumb only has a single interphalangeal joint. Next are the muscle attachment or the insertion of muscles seen in the phalanges bone. So the 4 tendons of flexor digitorum profundus attach to the proximal body of the distal phalanx, and flexor digitorum superficialis is inserted to the either side of corresponding middle phalanx. The other important muscles are extensor indicis, extensor digiti minimi, interossei muscles, that is dorsal and palmar, and extensor digitorium. Next are the blood supply. From the superficial palmar arch, a palmar digital artery supplies the ulnar aspect of the little finger. They are common palmar digital artery. They run distally along the web spaces between the fingers and bifurcate into a proper palmar digital arteries that supply adjacent fingers on the either side. Next, the clinical anatomy relevant to the phalanges bones are the fracture of the distal phalanx of middle finger is commonest, and it is being treated by splinting the injured phalanx to the adjacent normal finger, which is called as buddy splint. That is, the injured phalanx, that is the fractured phalanx, is being splinted along with the normal finger to have a grip and the support. So just recall about what are the topics we saw in this video. We saw about two bones, namely metacarpal and phalanges bone. We know metacarpals are 5 miniature long bones which are numbered from lateral to medial, and it has head which is placed distally, shaft and base at the proximal end. And characters like it is the first bone is shortest and stoutest of all metacarpal bones. The articulation is brought by metacarpophalangeal joints and also articulated by carpometacarpal joints, and insertions like extensor carpi radialis, ulnaris, longus, opponent pollicis and digiti minimi. Next, in clinical anatomy, we saw about fracture. Next are phalanges. There are 14 phalanges in each, and they consist of base, shaft and head. Articulations are brought by metacarpophalangeal joint, proximal and distal interphalangeal joint. The muscle attachment like flexor digitorium profundus, superficialis, extensor indicis, extensor digiti minimi and interossei muscles. Blood supply by superficial palmar arch, and the clinical anatomy of the phalanges bone is also a fracture. So I hope you understand the clinical anatomy and the base anatomy of the metacarpal and phalangeal bone. Thank you.